Hi, my name's Chloe. I'm a second-year student occupational therapist and I'm looking to see what allied health professionals do in a mental health setting. I'm here with Michelle. Would you be able to tell us more about you and your job role?
I can, yes. So I am an occupational therapist in a community perinatal mental health team. It's one of the teams that not everybody's heard of. We're relatively new in terms of mental health services generically, I suppose. But yeah, it's a team that focuses on working with women who are pregnant and up to a year after they've had their baby. So that is due to change soon, and we're going to be working up to about 2 years after someone's had a baby, which is very exciting. So there's some more funding coming, which is great. So lots more jobs and people to get to know in our team. So we would see women generally who are on the more moderate to severe end of the spectrum from a mental health point of view. So they might be people that have had mental health difficulties before and have been in other services, or it could be people that have never had any mental health issues at all in their whole entire lives, and then they have this massive transitional period where they become a mum, and all of a sudden they become really unwell and maybe don't quite know where to go or what to do. So that's where we would step in, hopefully, and help guide them through what could potentially be a really tricky time in their lives.
Oh, that sounds amazing. What does your typical day look like?
So a typical day is super varied, so it could be all sorts of different things, but that's one of the reasons why I love it. You might be, say, assessing somebody's mental health needs. You could be going out and doing a visit with the crisis team because somebody's really poorly. You might be going out and doing some occupational therapy specific stuff, so that could look like all sorts of different things, but at the moment I tend to do quite a lot of sensory work. So we will look at mum's sensory preferences and have a bit of a think about that with them and see whether they're maybe sensitive to the things that are going on around them, or maybe they love the more noise the better, and that's great. But sometimes there can be a bit of a discrepancy between them and their baby. So say a mum is really struggling with really loud noises, you put a lovely little newborn baby in front of them that screams to let them know that they're not happy, and that could be really, really difficult for them to deal with. So we would think about ways that they might be able to still care for their baby but also manage some of those sensory needs that they have. So it's very exciting, but equally it can be really challenging at times as well, because you're seeing people in a really vulnerable state. Exactly. So so it can be really, really difficult, but so rewarding when you see, you know, maybe could be a couple of weeks down the line, but more often kind of months where things are starting to turn around for them and they feel like they're really achieving what they wanted to within their role as being a mum.
That's brilliant. So what's your career look like?
So I left university and then went on to a Band 5 rotation, so found my first job on NHS jobs and went for quite a few interviews actually, because it can be quite tricky sometimes to get your foot in the door and kind of get to know what sort of area you might like to work in. So I had a Band 5 rotation. I'd had a job on a neuro rehab unit for a little while. That was at Band 5 level, and then went to Band 6 level when I came and worked in Gloucestershire and worked in a recovery team. So I did that for a couple of years, and then now I'm in perinatal and been doing that for a few years as well.
Brilliant.
So
What attracted you to working in mental health?
Oh, so many things. So had a little bit of a gut feeling at uni that it might be for me, but I know that doesn't happen for everybody, and that's totally okay. But I think it was the fact that it was truly holistic, I would say, and that you had ample opportunity to really get to know the people that you were going to work with, because time pressures in physical health settings are real and they are really, really challenging, and it can be very difficult to have enough time to do all the things that you want to do from a physical health perspective and get to know that person, because they might be with you for a really short period of time. So working in the community and working in mental health really afforded that opportunity for me, I think.
That's brilliant. And how does an OT help with recovery and mental health?
So, lots of ways. How to summarise. So, yeah, I would say that from a recovery point of view, it's about trying to help people work out and realise what is most meaningful and important to them. You'd think that might come quite easily, but sometimes it doesn't, because we've got so many pressures in life. Every single one of us, we all have mental health. It's not, you know, ring fenced for people that use mental health services. So actually, it's about trying to help that person to pick that apart, work out what's actually really important to them, and really focus on that. So it could be that you are kind of looking to help people to access a hobby that they haven't done before. It could be that you're just trying to help them to feel motivated enough to brush their hair in the morning. It's just whether it is the most important thing to that person. So as an occupational therapist, you have to be able to look at that person as a whole, piece all of those lovely little bits together to be able to work it out with the person. You're always alongside them and not leading. That's what I love.
Yes, a good way of putting it. Do you work with any other professions in your job role?
Yes, so I am very privileged in the perinatal team because I get to work with lots of different people within the mental health service that we run. So it could be that we're working with a psychologist that we have in our team, or the nursery nurses, social workers, there's the doctors, nurses, lots and lots of people, but not only them, but other physical health based services. So your midwife, your health visitors. We could be going over to the general hospital when someone's just had a baby, to the neonatal unit and liaising with them, or the ward. So you get lots and lots of interdisciplinary discussion, finding out about all sorts of things that you couldn't even dream of. And learning lots about how both kind of physical health settings and mental health settings merge, because having a baby, big deal for your body and a big deal for your brain.
What would you say to someone who's looking to start a career in mental health?
Do it.
Do it. Just do it.
Just do it. So I think if you're somebody that likes to get to know people and you like to kind of get your teeth into things, it's a brilliant place to work, because you actually, despite time pressures, which we all have, get a little bit more chance to do that. And I think on occasion probably think a little bit more creatively about how you might work with somebody.
That sounds brilliant. Thank you so much for coming here today.
That's all right, no problem. It's been a pleasure. Yay!